Giving aid to the victim is the third step in the 4A approach. In aquatic victims, in order to give aid to the victim, we need to bring him to the shore or to the stable dry ground. There are 4 basic techniques that we can do. One is called a reach out, second is throw out, third is row or boat out, and the fourth one is swim out. We're going to discuss all these 4 techniques in detail in another part of the lecture series. Now, once the victim is on the shore, we need to assess the victim's airway, breathing, and circulations. This is as usual. If you have done the basic life support or BLS and first aid, they will teach you how to do the airway, breathing, and circulations. If not, we will basically coach you here. Now, let's look. In order to assess ABC, we basically would like you to focus on these 3 things. 1 is the level of consciousness. 2 is the breathing of the patient or of the victims. And 3, whether he or she has any bleeding. Just concentrate on this thing. So, in order to assess those 3 things, what you can do is that you call the victim and look for his response. Whether he opens his eyes, whether he starts to talk, or he coughs, or there's no response. The next thing is actually you look at the victim as a whole, whether he is moving any part of his limb or he's just lying there quietly. You need to check for the breathing by looking for chest rise. Look at the victim chest and look where there's any rise. Sometimes you can also look at the abdomen, or some people call it the stomach. Next is to check for any severe bleeding. You don't have to look for small bleed, because small bleeds do not kill. You look for any torrential bleeding or severe exsanguination that coming from the victims. This can kill the victim. Now, once you've done that, if the victim is conscious, there's not an issue, there's no problem, because he can tell you whether he is having difficulty on breathing or not, and where is bleeding, because usually bleeding is associated with pain. The difficulty arises when the victim is unconscious, so you need to look hard for. Now, what should we do in an unconscious victim? Now, if the victim is breathing but he's also bleeding, what we need to do, we need to stop the bleed. When I say bleeding, it's actually I'm referring to big bleeds or severe bleeding. So we need to stop the bleed, and since he is unconscious, we need to turn him to recovery position to prevent aspiration. Next, if he is breathing unconscious but there's no bleeding, this is where you need only to turn him to recovery position, or to send him to hospitals, or you turn him to recovery and wait for the ambulance to come to pick the patient up. In an unconscious victim who is not breathing but is bleeding, now in this case we need to do CPR or cardiopulmonary resuscitation with or without need to stop the bleed, because victim who need CPR, they usually who's not breathing and the heart does not pump out blood. Therefore, in this case, the bleeding will stop by itself. So maybe you need to stop the bleed after you successfully performed the CPR and the patient has started to pump. The patient's heart has started to pump back again. Now, last but not least, if the patient is not breathing, okay, and there's no bleeding, you just concentrate on doing cardiopulmonary resuscitation or CPR. Now, this is a simple diagram to show what you need to do. Now, in doing CPR for layperson, now we will concentrate only a technique called compression-only CPR. These are the 10 steps you need to do. You need to assess his responsiveness, call for help, and then when you notice that he's not breathing, what you do, you start the chest compression by placing your hand in the center half of the chest, okay? At the center of the chest, at the lower half of the sternum. You have to compress about 5 to 6 centimeters deep, and you have to go at the rate of about 100 compression per minute for 2 continuous minutes. Now, after you have gone for 2 continuous minutes, you reassess back the victim. Okay, if no breathing and no signs of life, you need to continue back another 100 compression for 1 minute over 2 minutes. So basically you need to do 200 compressions of CPR, and you need to keep repeating step 8 and 9, doing 200 compression for 2 minutes, stop and recheck the victims until help arrives. Now, recovery position is a technique that you do for victim who is breathing, who is not bleeding, but is unconscious. The whole idea of doing recovery position is to keep the victim from aspiration if he vomits. These are the steps, which is easily shown in this picture. The important thing is to see the video of how this thing is being performed.